Hello and welcome back. You're watching the Arthritis Show. Well, joining us today in our studio is Dr. Sandra Doman. Hi, Dr. Doman. How you doing?
Good. How are you?
No, you practice chiropractic and you're also a yoga teacher. Tell us how you got introduced to yoga and how did that work out for you?
I went to school in Daytona Beach. I went to the Palmer College of Chiropractic. And when I was preparing to be a student there, I actually, before I even started school, I developed back pain. So I went to the student clinic and I was treated and my back pain got probably 75% better. But it wasn't enough for someone like me who's very physically active and participates in a lot of sports. And so dejected, I marched myself into a yoga studio because I couldn't do any running or weightlifting. And I ended up practicing yoga about 3 days a week for 4 weeks, after which 100% of my back pain went away.
That's perfect. That's perfect. Now, we're seeing a video that you're helping out the people at the University of Miami basketball team, right? How did you get hooked up with these people and how's your experience been?
I suppose like anything else, and that's also been the development of my practice, Miami Sports Chiropractic and Yoga Center, is that I was able to produce very good results in treating patients and helping to remove neck and back pain. So I was invited in August to be a treating chiropractor at the Dwayne Wade Fantasy Camp.
So word of mouth, essentially word of mouth.
So word of mouth. And when I was at the Dwayne Wade Fantasy Camp, Coach Jim Larinaga, who's the head coach of the University of Miami basketball team, he was treated by myself, and he was kind enough to invite me to be on his medical treatment team at his own fantasy basketball camp at the University of Miami.
Okay, and how often this camp is being held up for people out there? Is it a yearly camp or every year they do that,
Every
right?
year, both Dwayne Wade and Coach Larinaga host their fantasy basketball camps.
And right now you're actually adjusting one of the coaches, right?
I think, yeah, that's the head coach, Coach Larinaga.
You can see it on that screen as well. Okay, and now you like using this particular table because it moves around, right? It kind of tilts back and forth. How does that help with the adjustments, Doc?
So as you can see, what I'm doing here is that I have this special table that allows me to do manual lumbar decompression. And so this does a couple things. I find that when I'm assessing the joints of the low back, while the chiropractic adjustment, also known as spinal manipulation, is very effective for all different kinds of spine pain, sometimes I find that just by separating the joints and taking pressure off the joints, muscles, discs, ligaments, and nerves, that I can not only help to realign the joints and improve motion, but also help it last longer and prepare the site for physical activity and exercise.
Okay. So do you use this particular table routinely on your patients?
Absolutely. It just gives me more options in treating a whole different variety of spine pain.
Okay. Roman Garcia, you had a question for the doctor?
Doctor, normally anybody who has any kind of like low back issues, how many times a week should somebody seek to get treated and for it to be effective?
That's a great question. It depends on the patient and the condition. So historically, chiropractors have been vilified that once you see a chiropractor, you have to see them forever. And so I joke that I'm the treat and release chiropractor. When it comes to spinal adjustments and treating people, studies are showing that 4 to 12 treatments are typically sufficient to get people out of a pain mechanism. From there, however, what I have found is that most types of back pain, aside from fracture, tumor, infection, or organic referral, are lifestyle-based, such as osteoarthritis. So what I find is that in my office, after doing a basic short trial of conservative care, that I have to give patients a lifestyle solution to their lifestyle problem, which is how they developed back pain in the first place.
Exactly. And when you manipulate a joint, do you always have to hear it pop? Is you always hear it pop associated when you manipulate?
Absolutely not. And that's why chiropractic school is 4 years and not 4 weeks, because anybody can make a popping sound, but there's something to be said for having an expert diagnosis and treatment, which means that I check the spine for areas that are not moving in certain ranges of motion, and I check other areas of the spine for certain areas that are maybe moving too much that I want to stabilize. So the areas that are not moving, if I feel that they've moved and I can show a before and after that they're moving better, it doesn't matter if you hear the popping release sound or the cracking sound, as many people call it.
Exactly. And in your experience, is it the lowest, what level in the lumbar spine is normally the one that's most involved?
When it comes to osteoarthritis specifically, I would say it's L5-S1 or L4-L5 that I see most degenerative changes in the spine.
Okay, perfect. Well, Doc, I wanted to thank you again for joining us. We would love to have you again. We wanted to also talk about spinal stenosis a little bit before you go. What is the recommendation right now for chiropractic for spinal stenosis per se? That's a hard one in our practice as well.
I had a patient that was referred to me just this morning with horrific radiating spinal stenosis. Young guy too, 60 years old, marathon runner. He was sent to me by a massage therapist in Coral Gables. So I treat him. Most importantly, I use this table to take pressure off of the spine. And he says, "Are you ever going to be able to take my leg pain away?" And to that I say, like you understand, stenosis is by far the hardest thing to treat in my practice. Yes. So the best thing that I could possibly do, even if I can take 30% of his pain away, 40% of his pain away, by taking pressure off of the joints and then stabilizing the muscles of the back and the hips, patients can be more comfortable. So when it turns to severe stenosis, sometimes the question is not that I can make them 100% better, but can I make them more comfortable and functional?
Exactly. Well, I wanted again to thank you, take a moment and thank you again for joining us. We'd love to have you again on our show.
Thanks for having me.
This is all the time that we have today for this beautiful evening in South Florida. Please make sure you join us on the Monday show. On Monday show, Dr. Ronald Klass will be joining us, Dr. Martin Dayton. Thank you.